Hi, my name is Laura and I'm a physical therapist with Advanced Physical Therapy in our Bristol office. And today I want to talk to you about the hip flexors, which are an important muscle group that affect the way that we sit, the way that we walk, and the way that we run. So whether you're someone who would like to just work on general hip mobility and strength, or you're someone who has tightness in the front of the hips, I hope that this video is helpful for you. There are two main muscles that help us to flex the hip, one being the iliopsoas and one being the rectus femoris. So starting with the iliopsoas, so that's a muscle that attaches at the lower portion of the spine at these side joints here and comes across and connects at the front of the hip. The rectus femoris starts at the hip joint and then runs down to the front of the leg and attaches at the quadriceps tendon, which is like right above the knee joint and down into the patellar tendon. So I'm gonna show you how to assess for the tightness in both of these muscles. So this test that I'm about to show you is called the Thomas test, and it's a specific assessment tool that we use pretty frequently in the clinic. So what you're gonna do is lie at the very edge of a table or the bed, and you want your butt to be right up at the edge of the table, okay? The first thing you're gonna do is hug one knee into your chest nice and tight so that your back is nice and flat against the table. And then you drop the opposite leg. So ideally, what you want to see in this position is that your thigh goes down past parallel, I don't know if I'm there, and that your lower leg is at a 90-degree angle, okay? So that assesses both that muscle that I was talking about that crosses the hip joint and the one that crosses both the hip and the knee, okay? And then you can switch to the other side and see how they compare. So especially if you were positive on that test, let's get into a stretching exercise for you, okay? So the first thing you're gonna do, and this is to stretch the right hip flexor, your left leg is you're gonna be in a half kneeling position here with your left leg in front, okay? So the first thing that we need to do is what's called a posterior pelvic tilt. And if you think like your tailbone is like a dog's tail, you're gonna tuck your tail down. This allows us to get a better stretch to the hip flexors. It is a really important part of the stretch, okay? So tuck the tailbone back, and if you see what my hips just did, they rolled back, and then you're gonna start to lunge through that front leg and squeeze the right cheek, okay? You should already feel a stretch to the front of the hip, and if you don't, you can add an arm and get deeper into that stretch. So sometimes when we're having mobility issues or pain, stretching might not always be the only solution. Sometimes our muscles can be weak, contributing to some of that tightness and stiffness and pain. So one thing that you'll want to do after doing this exercise is follow it up with a strengthening exercise. So I'm going to show you two different variations of the same. So what I'm going to have you do, up against the wall, same thing, your tail tucked, and you're going to drive one knee up towards the wall and back down, okay? So this, like I said, this is working those muscles in the front of the hip. And then if you're feeling ambitious, you can add a loop band for resistance, and that's just gonna go right around the toes. Same thing. Tuck the pelvis, core nice and engaged and strong. You're gonna drive one knee up at a time, okay? So with this, you could do 2 rounds of 8 to start, see how it feels. Add a couple of reps in here and there if it feels good. But like I said, you'd wanna start just with the wall with no resistance, just to address your strength and stability and see how it feels.